My name is Paul Thomas, co-chair of COIN. This is a podcast to summarise our discussions of July when we considered where we're going to next and where we've come from. COIN originated in London from London Journal of Primary Care, and that originated from the 3 London RCGP faculties. And so it has got a strong history of general practice and primary care, but it along the way in the last few years has explored areas to do with public health and primary care networks, that is producing geographic areas and in ways in which they can be used to support collaborative activity in local areas. And also other things that can help health in those areas, like, for example, healthy deaths and what health is, as well as what diseases are, and how can collaboration for these things and different organisations happen inside these areas. And that resulted in a paper, COIP, Community Oriented Integrated Practice, that we have published on Health Matters Journal, which summarises in a way what COIN stands for. So what I'm doing now really is just summarising the discussions on July the 9th, 2023, when we agreed the following. COIN is concerned with community-oriented integrated practice, that is collaboration for health at local level. The agenda for COIN emerges from its members. So as the energy flows one way, we go in one way, and if it goes in another direction, it goes in another direction. Last year, 2022, the theme emerged of end-of-life care, which is why we started initiating initiatives to support carers of end-of-life. Previously, there'd been themes of mental health, theme of social prescribing. This year has been the emerging role of general practice and integrated primary care, particularly in the light in the UK of the crisis in the NHS. We're not particularly, although we're concerned with change, we're not particularly a pressure group, and we do not wish to raise funds in order to fund our activities, certainly not at this stage, because we much prefer operating inside the energies of member individuals and member organisations. So we would like from now on to make more of those collaborations and work more closely with different organisations, including, for example, the Futures Forum, RCGP, Interhub, primary care networks, that can share our vision for collaboration for health at local level. We want to encourage our presenters and authors to be more effective inside their own existing work. And they write a 700-word blog for Health Matters, but then also see that as a first draft of a paper they may wish to write somewhere else, thereby using their engagement with COIN as a launch pad for something both to do with their individual careers and the missions for which. It's a group of friends, a home for radical thinkers who care about communities. For example, the kind of idea that we may promote is that the ideas of individualism and collectivism as envisaged in the past are perhaps a little bit out of date, very out of date. Individuals do not stand alone, and neither do communities. Communities are networks of relationships, and individuals and senses of identity are intertwined. A sense of belonging and a sense of individuality are related to each other. And so how one imagines that dynamic interaction between individuals and communities is not so far different from thinking about the theory of the centre ground of politics, is not so far different from how one thinks about collaboration between different organisations for complex interventions, for geographic-based interventions that build communities, for creating a participatory democracy where people are able to think about the bigger picture. We have got great reach and great people, so perhaps we should be making a bit more of this. For example, global warming is a very important issue, and we should be at COIN taking on board how one helps address that.